we all know that the results in chronic myeloid leukemia patients are extraordinary today, thanks to the TKIs, which can let patients live in a great majority for the life, for normal lifespan. But even though we have some patients that lose response, and this is because we know we have a reservoir in the body of leukemia stem cells. This is not a new concept, of course, but it's relatively new that we can now, in chronic myeloid leukemia, detect leukemia stem cells directly in the blood by flow cytometry. Indeed, a few years ago, it was discovered that the CD26 marker is a specific marker for chronic myeloid leukemia stem cells, which is found in a subset population, which is CD34 positive, CD38 negative, and of course, CD26 positive. So we started to look at this chronic myeloid leukemia stem cells in the blood, starting with a retrospective study in which we measured these cells in more than 200 patients in any stage of their disease. And what we found that even in those patients that were nearly cured, I would say, because they had a very, very low level of disease, meaning they had a deep and stable molecular response, still we could measure a small number, but still detectable, of chronic myeloid leukemia stem cells in their blood. And even in those patients which are in so-called treatment-free remission stage, in which practically, as they had such a profound and prolonged molecular response, they can even stop their TKI treatment. Even in those patients, we found the persistence of chronic myeloid leukemia stem cells. In this particular study, we wanted to see what is the destiny actually of these cells and what is the meaning of these cells. And so we started a prospective study, including many centers in Italy. And at diagnosis, we starting receiving the blood of this patient, and we measure at the baseline and then at different time points, after 3 months, 6 months, 12 months, and so on, the amount of chronic myeloid leukemia stem cells in their body. So in this particular study, we did a prospective study, including many centers in Italy, hematological centers, in which we looked at the destiny of these chronic myeloid leukemia stem cells in the blood, starting from diagnosis. Practically, we measure the number of CD26 positive leukemia stem cells in the blood at time 0 at the baseline, and then at several time points during treatment. 100% of patients at the diagnosis showed a consistent number of CD26 positive leukemia stem cells in the range of 7 average per microliter, because we can measure them exactly in the number. But just after 3 months, this number dropped significantly, and we had about 0.2, 0.1 cells per microliter at that time. Continuing the TKI treatment, regardless of the type of TKI treatment, these leukemia stem cells remain detectable in the blood at a very, very low level, but still detectable. And this was practically seen in 182 patients. These are included so far in this study, and regardless of the type of treatment they received, which is of course free for the physician to decide. Imatinib, the majority of patients, but also several patients had nilotinib, and other patients had dasatinib. So the behavior of the chronic myeloid leukemia stem cells is practically a fluctuating number along the treatment. What was interesting in this study was that when we looked at the characteristic of the patient included in the treatment, for example, we saw, and this is pretty understandable, that patients treated with dasatinib and nilotinib were much younger than the patient treated with imatinib. Today in Italy, older patients usually receive imatinib, while younger patients receive second-generation TKI. But when we looked at the number of leukemia stem cells at diagnosis in these subtypes of patients, for example, we saw that the level was higher, meaning that in a imatinib patient, we had about 4 cells per microliter, while in the nilotinib and dasatinib group of patients, we had 12 and even 17 cells per microliter. It looks like in the younger patient, we may have more stem cells at the diagnosis of the chronic myeloid leukemia. Another interesting part of the study was that we had 33 patients that switched TKI. 13 of them because of intolerance, but 20 because of failure. And when we look at these 20 patients that switched because of failure, and we looked at their amount of leukemia stem cells at the beginning, at the diagnosis, they had definitely the highest amount of CD26 positive leukemia stem cells. So it looks like that probably the number of leukemia stem cells that you have at the beginning of your study, of your disease, could somehow have a role in the future response to TKI treatment. But of course, this data need to be confirmed in a larger setting, and also by following this patient longer than what we did so far. Of course, now we still have to answer several questions because, okay, these leukemia stem cells exist, but they persist also, and they persist even in patients, as I said, that they stop TKI treatment. So what do they do? Where they go? What is their destiny? Practically, we think that probably it's the immune system which can control them after a certain point. And that's why we are looking also at certain markers on the surface of these leukemia stem cells, which can better favor their control by the immune system. And one of these markers is PD-L1, which of course is a marker, is an antigen that can turn off the response of T cells against tumors. And we looked in 61 patients at the expression of PD-L1 in this particular myeloid stem cells, chronic myeloid stem cells population. And they're not all the same, the stem cells. And about half of them have indeed a strong positivity for PD-L1, but half of them, meaning half of the patients, don't have this positivity. And when we looked at the patient in which we found a high positivity for PD-L1, these are the patients in which the number of leukemia stem cells at diagnosis was higher. So maybe the number has a meaning at the diagnosis. Maybe the type of leukemia stem cells has a meaning. Indeed, when it's PD-L1 positive, it may be a type of stem cells that is more difficult to eradicate in the body. And so our study is going on, and we are trying to answer this question, which I think they're very important, because they will tell us exactly, for example, if you can find a way to detect which patient can really stop TKI, because they have maybe a certain number of leukemia stem cells, they have a certain type of leukemia stem cells persisting, and so they can easily interrupt the drug, even, for example, if they didn't have such a deep molecular response. Or instead, find out which patient that unfortunately cannot stop treatment. But even in this patient, we know now that continuing TKIs, the life is anyway very good, and their lifespan is practically normal.